explain a bit about my background in addition to being a social worker in both mental health and child welfare and public health. For the past 18 years, I was a special education teacher, and I feel like I've had, in all these situations, I've had a front row seat on the challenges that children and parents face when they have any kind of vulnerability or special need. And I've been painfully aware that parents just feel so powerless when they're in the situation trying to advocate for their children in a public school setting when their child has difficulties. And they are searching for guidance about ways to do anything that will help their child. And they are, in most cases, completely unaware and want to know how exposure to wireless affects their children. They want to know what they can do at home and what they can say to their children who are, by this time adolescents and really, really habituated to having wireless internet all the time and using it all the time. What can they say when they don't have a guideline to say, this much exposure is reasonable, and you stop that exposure as, the American Academy of Pediatrics recommends, so many hours before you have to sleep, because some of the most debilitating problems faced by the adolescents that I've worked with are headaches, insomnia, anxiety that is crippling. It's crippling to them socially and educationally. And further, as adults, we don't, not only do we not have guidelines, but we don't at this point have any warning when we enter a public space, like a library or a school, as to where the Wi-Fi is and where we have to look around. If one is already aware that they have a sensitivity and that they experience debilitating problems from exposure to a high level of wireless signal, we don't know where to look, and we don't know until we already experience symptoms that we have to leave.
Can I just ask, Ms. Doonan, so when you're talking about the headaches, insomnia, anxiety, are you saying that, I just want to be clear, are you saying that's a result of device use or of Wi-Fi itself?
I'm saying that there's just, no one's tipping anyone off that could be a factor, and that maybe they could try out a reduction in exposure to find out if that makes an improvement, because the people that I speak with are searching for answers of anything they can do that has a chance of helping their child feel better.
Okay.